Hi and welcome to Shorts in Psychology. In this video, we will examine some of the causes and symptoms of anxiety disorders using the 4 levels of explanation of behaviour. We will also categorise some of the available treatments under these same 4 levels. For more details on each of the 4 levels of explanation of behaviour, watch the relevant Shorts in Psychology video linked in the comments below. Before we start explaining anxiety using these 4 levels, let's distinguish between a cause and a symptom. A cause is a reason or origination for a condition and is something that brings about an effect. A symptom, on the other hand, is a physical or mental feature that indicates the presence of a disorder. So let's now look at some of the causes, symptoms, and treatments for anxiety disorders under each of the 4 levels. Bear in mind that for each level, only the most common causes and symptoms will be described. There are many interrelated factors associated with anxiety disorders. The cause of a particular disorder vary, and it isn't always easy to determine a cause in every case. Furthermore, which symptoms an anxiety sufferer experiences differs from individual to individual. Let's begin by examining some of the biological causes of anxiety disorders. It is well established that the tendency to develop anxiety disorders runs in families, similar to a predisposition to other illnesses such as diabetes and heart disease. Large-scale genetic association studies have shown that genetic factors may encourage or even cause the occurrence of anxiety disorders. However, it is not fully elucidated which genes or regions of nuclear or mitochondrial DNA or which types of genetic changes, alone or in combination, can represent reliable genetic markers of anxiety. Some anxiety disorders may be related in part to a chemical imbalance in the brain. The neurotransmitters serotonin, dopamine, noradrenaline, and GABA are specifically believed to be linked to anxiety disorders. First, serotonin is a neurotransmitter that is largely associated with mood, sleep, appetite, and other regulatory functions in the body. Experts have also found that reduced levels of serotonin are connected to depression and anxiety. The neurotransmitter dopamine may also contribute to symptoms. Dopamine influences, among other functions, a person's energy levels, attention, rewards, and movement, which may lead to anxiety symptoms if imbalanced. Noradrenaline is also related to anxiety as it involves the fight or flight response, or how a person reacts to stress. Last, GABA plays a role in balancing excitement or agitation and feelings of calm and relaxation. Anxiety disorders probably arise from an excessive activation of the brain mechanism underlying fear and the fight or flight response, and most of the biological symptoms associated with anxiety disorders occur as a result of this. These include increases in heart rate and breathing, muscle tension, difficulty swallowing, sweating, chills or hot flushes, trembling, dizziness, and nausea or gastrointestinal discomfort. Research shows that some form of sleep disruption is present in nearly all psychiatric disorders. Not only does anxiety cause sleeping problems, including insomnia, but studies have shown that people with chronic insomnia are at a high risk of developing an anxiety disorder. The main form of treatment that fits under the biological level of explanation is medication, aimed at correcting the biochemical imbalance in the brain. This includes antidepressants such as selective serotonin reuptake inhibitors, anti-anxiety drugs such as benzodiazepines, and sedatives. The basic processes level of explanation encompasses universal psychological processes such as learning, cognition, and emotions. Some people exposed to situations, people, or objects that are upsetting or anxiety arousing may develop an anxiety response. This learned response can be reactivated when faced with or thinking about the situation, person, or object again. For example, in phobias, the sufferer has been classically conditioned to associate a particular object such as a spider with fear. Anxiety can also be acquired via operant conditioning. A student experiencing anxiety about school and exams may have learned this through previous punishment when they failed their exams. Lastly, an individual may learn to be anxious about heights or snakes via observational learning from growing up with others who are anxious about these same things. Underlying all anxiety disorders are common emotions such as irritability, fear, and worry. They worry constantly in an attempt to define and describe their problems. Anticipation of disaster and the physical symptoms of anxiety are mutually reinforcing. Often people with anxiety will also use thought suppression and avoidance in an attempt to reduce their physical symptoms. Excessive anxiety and worry are difficult to control and can impair concentration. Furthermore, individuals suffering from anxiety tend to pay selective attention to either external stimuli viewed as potential threats or internal stimuli such as their symptoms. Thinking errors such as magnification, catastrophizing, overgeneralization, and interpretation bias are all symptoms of anxiety as well as contributing to the cause, worsening symptoms. Interventions such as cognitive therapy and CBT help people with anxiety disorders to recognize and address the psychological contributors to anxiety. For more detail on CBT specifically and how it can be used to treat anxiety, watch the Shorts in Psychology CBT video linked in the comment below. In the case of phobias, systematic desensitization can be effective at counter-conditioning the learned fear response and replacing it with relaxation. The person level encompasses individual differences between people. People with some personality traits, such as shyness, neuroticism, and pessimism, may also be more vulnerable to developing anxiety disorders. Individuals who are easily aroused and upset and are very sensitive and emotional are more likely to develop anxiety disorders. Poor problem-solving skills and the ability to manage stress and anxiety are other individual characteristics that could lead to anxiety. Sometimes a change in personality can also be a symptom of an anxiety disorder. For example, a normally extroverted individual becoming very withdrawn and introverted. The socio-cultural level of explanation focuses on the influence of other people and the cultural context in shaping behaviour. Many life experiences can contribute to anxiety disorders. This includes lack of social support and childhood trauma. Severe or constant stress from environmental stresses such as decreased job security can produce a hyperactive anxiety reaction. Impression management can also be a cause of anxiety if trying to fit social and cultural norms and not doing so. This could include expectations related to academic and financial achievement, work and marriage. Furthermore, upward social comparisons can contribute to anxiety if the individual is not achieving the goals being set. Symptoms of anxiety at the socio-cultural level could include a withdrawal of activity with others or obvious panic attack when faced with anxiety-producing activities involving others. A fear of being bullied, belittled, or perceived as weak may also prevent the sufferer from seeking help in learning how to overcome their anxiety. As I mentioned before, this is just an overview of some of the main causes and symptoms of anxiety disorders, but these vary for each individual. However, hopefully this has helped you to gain a better understanding of how some of them fit under each level of explanation of behaviour, as well as the main forms of treatment. As always, thanks for listening.